Principles of Naturopathy, Nature and Cure. Definition of Naturopathy. Naturopathy, also known as naturopathic medicine, is a holistic approach to healthcare that emphasizes the use of natural remedies and the body's intrinsic ability to heal and maintain itself. It integrates traditional healing methods with modern scientific knowledge to promote overall health and well-being. Naturopathy focuses on treating the whole person, considering physical, mental, emotional, and environmental factors. Nature Cure Principles 1. The healing power of nature, vis medicatrix naturae. Trusting in the body's inherent wisdom to heal itself. Vis medicatrix naturae, a Latin phrase meaning the healing power of nature, refers to the body's inherent ability to heal itself. This concept is a cornerstone of naturopathic medicine and holistic health practices, emphasizing the role of natural processes in maintaining and restoring health. Here are some key aspects and principles related to the healing power of nature. Innate healing ability. The body has a self-regulating and self-healing capacity. This includes the immune system, the regenerative processes of cells, and the ability to detoxify and eliminate waste. Holistic approach. Health is viewed as a balance of physical, mental, and spiritual well-being. Naturopathic medicine considers the whole person, not just symptoms, in diagnosis and treatment. Prevention and education. Emphasis is placed on preventing illness through lifestyle choices, including diet, exercise, and stress management. Educating individuals about healthy habits is fundamental. Natural therapies. Utilizing natural remedies such as herbs, nutrition, hydrotherapy, and physical therapies to support the body's healing processes. Mechanisms of natural healing. Immune system. The body's defense mechanism against infections and diseases. Proper nutrition, adequate sleep, and stress management can strengthen the immune system. Detoxification. The liver, kidneys, skin, and lungs work to eliminate toxins. Supportive practices include hydration, proper diet, and sometimes detox programs. Regeneration. Cells and tissues can regenerate and repair themselves. This process is supported by adequate nutrition, rest, and avoidance of harmful substances. Homeostasis. The body's ability to maintain stable internal conditions. Proper hydration, nutrition, and stress reduction help maintain homeostasis. Applications in modern medicine. Diet and nutrition. Whole foods, rich in nutrients, support bodily functions and promote healing. Specific diets can be tailored to individual health needs. Herbal medicine. Plants and herbs with medicinal properties are used to treat various conditions and support overall health. Physical activity, regular exercise improves circulation, enhances the immune system, and supports mental health. Mind-body practices. Techniques such as meditation, yoga, and mindfulness reduce stress and support mental and physical health. Evidence and research. Scientific research increasingly supports the benefits of natural healing practices. Studies have shown the effectiveness of certain herbs, the impact of diet on chronic diseases, and the benefits of stress reduction techniques on overall health. The healing power of nature is a profound concept that underscores the importance of natural processes and holistic approaches in maintaining health. By supporting the body's innate ability to heal through natural means, we can achieve better health outcomes and enhance our overall well-being. This approach not only treats symptoms, but also addresses the root causes of illness, promoting a more sustainable and integrative form of healthcare. 2. Identify and treat the cause, tolle causam, addressing the underlying causes of illness rather than just treating symptoms. Tolle causam, another Latin phrase used in the context of medicine, translates to identify and treat the cause. This principle is central to various medical philosophies including naturopathic medicine and functional medicine. Root cause analysis. Instead of merely addressing symptoms, this principle advocates for identifying and addressing the underlying cause of illness or dysfunction. Holistic perspective. It involves looking beyond the immediate symptoms to understand the interconnected factors contributing to health issues. This includes physical, mental, emotional, environmental, and lifestyle factors. Preventive approach. By addressing root causes, it aims to prevent recurrence or progression of diseases and promote long-term health and wellness. Application and practice. Comprehensive assessment. Healthcare practitioners conduct thorough assessments to understand patients' medical history, lifestyle factors, environmental exposures, and genetic predispositions. Diagnostic investigations. Utilizing various diagnostic tools including laboratory tests, imaging studies, and specialized assessments to uncover underlying imbalances or dysfunctions. Individualized treatment plans. Based on the findings, personalized treatment plans are developed to address the root causes. These may include dietary changes, lifestyle modifications, targeted supplementation, stress management techniques, detoxification protocols, and other interventions. Collaborative care. In some cases, addressing the root cause may require collaboration among different healthcare professionals such as physicians, nutritionists, psychologists, physical therapists, and others. Patient education and empowerment. Educating patients about the factors contributing to their health issues empowers them to take an active role in their healing journey. This includes providing guidance on healthy lifestyle practices and self-care strategies. Examples: chronic inflammation. Instead of merely prescribing anti-inflammatory medications for conditions like arthritis, the underlying factors contributing to inflammation, such as poor diet, stress, gut dysbiosis, are identified and addressed through dietary changes, stress management techniques, and targeted supplementation. Digestive disorders. Rather than solely focusing on symptom relief for conditions like irritable bowel syndrome, IBS, functional medicine practitioners may investigate underlying factors such as food sensitivities, imbalanced gut microbiota, or intestinal permeability, leaky gut, and develop a comprehensive treatment plan addressing these root causes. Autoimmune diseases. In autoimmune conditions, the immune system mistakenly attacks the body's own tissues. Tolocosm approach involves identifying triggers, such as infections, environmental toxins, or dietary factors, and immune dysregulation mechanisms, and implementing interventions to modulate the immune response and address underlying imbalances. Tolocosm emphasizes the importance of investigating and addressing the root causes of illness, rather than merely managing symptoms. By adopting a holistic and personalized approach to healthcare, practitioners can promote true healing and empower patients to achieve optimal health and well-being. 3. First, do no harm, primum non nocere. Utilizing the most natural, least invasive, and least toxic therapies. Primum non nocere, a Latin phrase meaning first do no harm, is a fundamental principle in medical ethics and practice. It highlights the importance of avoiding actions that could potentially cause harm to patients. Here's a closer look at its significance and application. Principle explanation. Patient safety. The primary concern of healthcare professionals is to ensure the safety and well-being of their patients. This principle underscores the importance of minimizing risks and adverse effects associated with medical interventions. Beneficence and non-maleficence. Alongside the obligation to benefit patients, beneficence, there's an equally important duty to avoid causing harm, non-maleficence. Primum non nocere emphasizes the latter aspect of ethical practice. Risk-benefit assessment. Before recommending any medical intervention, healthcare providers must carefully evaluate the potential risks and benefits. The goal is to maximize benefits while minimizing harm. Application and practice. Informed consent. Patients have the right to be fully informed about the risks and benefits of proposed treatments or procedures. Healthcare providers must ensure that patients understand these aspects before proceeding. Evidence-based practice. Medical decisions should be based on sound scientific evidence and clinical judgment. This includes considering the safety profile of interventions and avoiding practices that lack sufficient evidence or pose undue risks. Monitoring and surveillance. During and after medical interventions, healthcare providers monitor patients for any signs of adverse effects or complications. Prompt recognition and management of adverse events are essential for minimizing harm. Personalized medicine. Recognizing that each patient is unique, healthcare providers tailor treatment plans to individual circumstances, including factors such as medical history, comorbidities, genetic predispositions, and preferences. This personalized approach helps mitigate risks and optimize outcomes. Continuing education and professional development. Healthcare professionals engage in ongoing learning to stay updated on the latest evidence, guidelines, and best practices. This commitment to lifelong learning enhances their ability to deliver safe and effective care. Examples: medication management. Healthcare providers consider factors such as drug interactions, allergies, and contraindications before prescribing medications. They also monitor patients for potential adverse effects and adjust treatment plans accordingly. Surgical procedures. Surgeons take precautions to minimize the risks of surgical complications, such as infections, bleeding, or organ damage. They adhere to strict sterile techniques, use appropriate anesthesia, and closely monitor patients during and after surgery. Alternative therapies. Practitioners of complementary and alternative medicine, CAM, also adhere to the principle of primum non nocere. They evaluate the safety and efficacy of treatments, provide clear communication to patients, and ensure that interventions do not pose undue risks. Primum non nocere serves as a guiding principle in healthcare, reminding practitioners of their ethical duty to prioritize patient safety and well-being. By upholding this principle, healthcare professionals strive to deliver care that maximizes benefits while minimizing harm, thereby earning the trust and confidence of their patients. 4. Doctor as teacher, docere. Educating patients in the steps to achieving and maintaining health. Docere, another Latin term often associated with medicine, translates to doctor as teacher. This principle emphasizes the role of healthcare professionals not only as providers of medical treatment but also as educators who empower patients to take an active role in their own health and well-being. Patient education. Healthcare providers have a responsibility to educate patients about their health conditions, treatment options, and preventive measures. This education empowers patients to make informed decisions and actively participate in their care. Promotion of health literacy. Docere aims to enhance patients' understanding of health-related concepts, terminology, and self-care practices. It fosters health literacy, enabling patients to navigate healthcare systems more effectively and advocate for their own needs. Lifestyle modification. By providing guidance on healthy lifestyle habits including diet, exercise, stress management, and sleep hygiene, healthcare professionals help patients adopt behaviors that promote optimal health and prevent disease. Clear communication. Healthcare providers communicate in clear, understandable language, avoiding jargon and technical terms that may confuse patients. They encourage questions and dialogue to ensure that patients fully comprehend their medical conditions and treatment plans. Individualized education plans. Recognizing that each patient is unique, healthcare professionals tailor educational efforts to patients' specific needs, preferences, and cultural backgrounds. This personalized approach enhances the effectiveness of patient education and promotes better health outcomes. Shared decision-making. Docere fosters a collaborative approach to healthcare, where patients and providers work together to develop treatment plans that align with patients' values, preferences, and goals. Shared decision-making empowers patients to actively participate in their care and enhances treatment adherence. Use of educational resources. Healthcare providers utilize various educational resources such as pamphlets, videos, websites, and interactive tools to supplement verbal discussions and reinforce key messages. These resources cater to diverse learning styles and facilitate patient engagement. Examples: chronic disease management. For patients with chronic conditions such as diabetes or hypertension, healthcare providers educate them about the importance of medication adherence, monitoring blood glucose or blood pressure levels, maintaining a healthy diet, and engaging in regular physical activity. Preventive care. During routine checkups and screenings, healthcare professionals educate patients about the importance of preventive measures such as vaccinations, cancer screenings, and lifestyle modifications to reduce the risk of developing chronic diseases. Medication management. When prescribing medications, healthcare providers explain the purpose, dosage, potential side effects, and important precautions to patients. They address any concerns or questions patients may have to promote safe and effective medication use. Docere underscores the vital role of healthcare providers as educators who empower patients to make informed decisions and take an active role in their health. By fostering open communication, personalized education, and shared decision-making, healthcare professionals facilitate collaboration with patients, leading to improved health outcomes and enhanced patient satisfaction. 5. Treat the whole person. Considering all factors, physical, mental, emotional, genetic, environmental, social, and spiritual, that influence health. Treat the whole person is a foundational principle in holistic healthcare, emphasizing the interconnectedness of the various aspects of an individual, physical, mental, emotional, social, and spiritual, and the importance of addressing all these dimensions to promote optimal health and well-being. Holistic perspective. Rather than focusing solely on isolated symptoms or specific disease processes, treating the whole person involves considering all aspects of an individual's health and life circumstances. Mind-body connection. Acknowledging the intimate relationship between mental and physical health, this principle recognizes that emotional and psychological factors can profoundly influence physical well-being, and vice versa. Individualized care. Each person is unique, with their own set of experiences, beliefs, values, and preferences. Treating the whole person requires personalized approaches that take into account these individual differences. Comprehensive assessment. Healthcare providers conduct thorough assessments that encompass physical health, mental and emotional well-being, lifestyle factors, social support systems, and spiritual beliefs. This holistic evaluation provides a comprehensive understanding of the patient's needs and challenges. Integrated treatment plans. Based on the assessment findings, healthcare professionals develop individualized treatment plans that address multiple aspects of the person's health and life. These plans may include a combination of conventional medical interventions, lifestyle modifications, complementary therapies, and psychosocial support services. Patient-centered care. In keeping with the principle of treating the whole person, healthcare providers engage patients as active partners in their care. They collaborate with patients to set realistic goals, prioritize interventions, and make decisions that align with the patient's values and preferences. Examples: chronic pain. Management. Rather than focusing solely on pain relief through medication, a holistic approach to chronic pain management may involve addressing contributing factors such as stress, sleep disturbances, emotional distress, and functional limitations. Treatment modalities may include physical therapy, relaxation techniques, cognitive behavioral therapy, and nutritional counseling. Mental health treatment. When treating mental health conditions such as depression or anxiety, healthcare providers consider biological, psychological, and social factors that contribute to the individual's symptoms. In addition to medication or psychotherapy, interventions may include lifestyle changes, social support interventions, and mindfulness practices. Cancer care. In cancer treatment, a holistic approach involves not only addressing the physical aspects of the disease, but also providing psychosocial support, symptom management, nutritional guidance, and spiritual care. Integrative therapies such as acupuncture, massage therapy, and music therapy may complement conventional cancer treatments to enhance overall well-being. Treating the whole person reflects a comprehensive and integrative approach to healthcare that recognizes the multidimensional nature of human health and wellness. By addressing physical, mental, emotional, social, and spiritual aspects of an individual's life, healthcare providers can promote healing, enhance quality of life, and support individuals in achieving their full potential for health and well-being. 6. Prevention. Focusing on overall health, wellness, and disease prevention. Prevention is a cornerstone of healthcare that focuses on proactively reducing the risk of illness, injury, and other adverse health outcomes before they occur. It encompasses various strategies and interventions aimed at promoting health and well-being across populations and individuals. Here's a closer look at the significance and application of prevention in healthcare. Importance of prevention. Promoting health and wellness. Prevention aims to optimize health and well-being by encouraging healthy behaviors, reducing risk factors, and enhancing protective factors. Reducing disease burden. By preventing diseases and injuries, prevention efforts can reduce the overall burden on healthcare systems, improve healthcare cost-effectiveness, and enhance population health outcomes. Empowering individuals. Prevention empowers individuals to take control of their health through informed decision-making, healthy lifestyle choices, and proactive healthcare practices. Types of prevention. Primary prevention. Primary prevention aims to prevent the onset of disease or injury before it occurs. This includes health promotion activities, immunizations, screenings, and interventions targeting modifiable risk factors such as smoking, poor nutrition, and sedentary lifestyle. Secondary prevention. Secondary prevention focuses on early detection and intervention to mitigate the progression of disease and prevent complications. Examples include cancer screenings, routine health checkups, and management of chronic conditions to prevent exacerbations. Tertiary prevention. Tertiary prevention aims to prevent further complications and disabilities in individuals already diagnosed with a disease or injury. This involves rehabilitation, disease management programs, and supportive care to optimize functional outcomes and quality of life. Strategies for prevention. Health promotion and education. Providing information and resources to promote healthy behaviors such as regular exercise, balanced nutrition, stress management, and tobacco cessation. Policy and environmental changes. Implementing policies and creating supportive environments that facilitate healthy choices, such as smoke-free laws, access to nutritious foods, safe walking paths, and workplace wellness programs. Clinical preventive services. offering preventive healthcare services such as vaccinations, screenings, counseling, and interventions during clinical encounters to identify and address risk factors and promote early detection of diseases. Community-based interventions, engaging communities in initiatives that address social determinants of health, promote health equity, and create supportive environments for healthy living through partnerships, advocacy, and community empowerment. Challenges and considerations: access and equity, ensuring equitable access to preventive services and interventions, particularly among underserved populations and marginalized communities, to address disparities in health outcomes. Behavior change, encouraging sustained behavior change and adherence to preventive measures, which may require addressing individual, social, cultural, and environmental factors influencing health behaviors. Resource allocation, allocating resources effectively to support comprehensive prevention efforts, including funding for research, healthcare infrastructure, public health programs, and community initiatives. Prevention plays a vital role in promoting health, reducing the burden of disease, and enhancing the well-being of individuals and populations. By implementing comprehensive prevention strategies across multiple levels, individual, community, and society, healthcare systems can foster a culture of wellness, empower individuals to make healthier choices, and create environments that support optimal health for all. Naturopathy is a form of alternative medicine that emphasizes the body's intrinsic ability to heal and maintain itself. It integrates various natural therapies to promote wellness and prevent illness. The scope of naturopathy includes a wide range of practices and approaches. Scope of naturopathy: 1. Holistic approach. Naturopathy treats the individual as a whole, considering physical, mental, emotional, and spiritual health. It aims to identify and address the root causes of illness rather than just treating symptoms. 2. Preventive care. Emphasis on prevention and health promotion. Uses lifestyle and dietary counseling to help prevent chronic diseases and maintain overall health. 3. Natural therapies. Herbal medicine utilizes plants and plant extracts for therapeutic purposes. Nutrition and diet focuses on the role of food and nutrition in maintaining health and treating disease. Homeopathy employs highly diluted substances to stimulate the body's self-healing response. Hydrotherapy uses water in various forms and temperatures to promote healing. Physical medicine involves physical therapies such as massage, exercise, and manipulation to support health. Acupuncture and traditional Chinese medicine incorporates techniques to balance the body's energy systems. 4. Patient education. Naturopaths educate patients about lifestyle choices, stress management, and self-care practices. Encourages active patient participation in their own health care. 5. Diagnostic techniques. Naturopaths use both conventional diagnostic tools, like blood tests, and alternative methods, like iridology and kinesiology. Focuses on understanding the patient's overall health status and identifying potential imbalances. Chronic disease management. Naturopathy is often used to manage chronic conditions such as allergies, digestive issues, cardiovascular diseases, hormonal imbalances, and autoimmune disorders. Utilizes a combination of diet, supplements, and lifestyle modifications to manage symptoms and improve quality of life. Complementary and integrative medicine. Naturopathy can be used alongside conventional medical treatments, works in conjunction with other healthcare providers to offer a more comprehensive approach to healthcare. Regulation and education. Naturopathy is regulated in some countries and states, requiring practitioners to have formal education and licensure. Educational programs include extensive training in basic sciences, clinical sciences, and natural therapies. Growing body of research supports the efficacy of various naturopathic treatments. Practitioners are increasingly integrating evidence-based practices into their therapeutic approaches. Specialty areas in naturopathy. Detoxification. Naturopathy often includes detoxification practices to remove toxins from the body, which may involve dietary changes, fasting, or the use of herbal supplements. Mind-body medicine. Techniques such as mindfulness, meditation, yoga, and biofeedback are used to promote mental and emotional well-being. Addresses stress, anxiety, depression, and other mental health issues through natural methods. Pediatric care. Naturopathic treatments tailored for children include nutritional counseling, herbal remedies, and lifestyle advice to support healthy development and treat common childhood ailments. Women's health. Focus on reproductive health, hormonal balance, menopause management, fertility issues, and menstrual disorders. Natural therapies can provide support for conditions such as polycystic ovary syndrome, PCOS, endometriosis, and premenstrual syndrome, PMS. geriatric care, addressing the health needs of the elderly, including management of chronic diseases, cognitive decline, and improving overall quality of life. Emphasis on gentle, non-invasive treatments suitable for older adults. Modalities and techniques. Clinical nutrition, detailed nutritional assessments and personalized dietary plans. Use of specific diets, for example, anti-inflammatory diet, elimination diet, to treat and manage health conditions. Botanical medicine. Comprehensive use of herbs and plant extracts, creating custom herbal formulas based on individual patient needs. Homeopathy, prescribing highly diluted substances aimed at triggering the body's natural healing processes, often used for chronic conditions and as a complementary therapy. Physical and manual therapies, includes chiropractic adjustments, osteopathic manipulations, and therapeutic massage, aimed at relieving pain, improving mobility, and enhancing physical function. Hydrotherapy. Use of water in various forms, hot and cold baths, steam, compresses, to treat a range of conditions. Beneficial for improving circulation, relieving pain, and detoxification. Clinical applications, cardiovascular health, managing hypertension, high cholesterol, and other heart-related conditions through diet, lifestyle changes, and supplements. Digestive health, treating conditions such as irritable bowel syndrome, IBS, Crohn's disease, and food intolerances with dietary adjustments and natural supplements. Immune support, enhancing immune function and addressing autoimmune disorders with natural therapies. Metabolic and endocrine health, managing diabetes, thyroid disorders, and metabolic syndrome with personalized care plans focusing on nutrition, exercise, and herbal medicine. Integration with conventional medicine. 1. Collaborative care. Naturopathic doctors often work alongside conventional healthcare providers to offer integrated care. This approach can enhance patient outcomes by combining the strengths of both conventional and naturopathic medicine. 2. Patient advocacy. Naturopaths often act as patient advocates, helping individuals navigate the healthcare system and make informed decisions about their healthcare. Education and professional development. 1. Naturopathic medical schools. Comprehensive programs that include coursework in basic sciences, clinical sciences, and naturopathic principles. Extensive clinical training under supervision to prepare for professional practice. 2. Continuing education. Ongoing education to stay updated with the latest research and advancements in naturopathic medicine. Participation in professional organizations and attending conferences and workshops. Research and evidence. 1. Scientific research. Increasing body of research supporting the efficacy of naturopathic treatments. Studies on herbal medicine, nutritional interventions, and mind-body techniques. 2. Evidence-based practice. Incorporating the best available evidence into clinical decision-making. Balancing traditional knowledge with modern scientific findings. Naturopathy offers a comprehensive and integrative approach to healthcare, focusing on natural and preventive strategies. Its diverse modalities and holistic philosophy make it a valuable complement to conventional medical practices, catering to a wide range of health needs and promoting overall well-being. Mental sharpening. Multiple choice questions. 1. Which of the following is not a principle of naturopathy? A. The healing power of nature. B. Identify and treat the causes. C. Treat the symptoms alone. D. Doctor as teacher. 2. What is the primary focus of naturopathic treatment? A. Symptomatic relief. B. Suppressing diseases. C. Addressing lifestyle and diet. D. Prescribing pharmaceutical drugs. 3. Which of the following is considered a fundamental belief in naturopathy? A. The body cannot heal itself. B. The body has an inherent ability to heal. C. Diseases are caused solely by external factors. D. Only modern medicine can cure diseases. 4. Naturopathy emphasizes which type of prevention? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. None of the above. 5. Hydrotherapy, a common practice in naturopathy, involves the use of A. Air. B. Herbs. C. Water. D. Minerals. 6. Which vitamin is primarily associated with immune system support in naturopathy? A. Vitamin A. B. Vitamin C. C. Vitamin D. D. Vitamin K. 7. According to naturopathic principles, which of the following best supports digestive health? A. High sugar diet. B. High processed food intake. C. High fiber diet. D. Low water intake. 8. Which of the following is a common naturopathic approach to detoxification? A. Prescription medications. B. Fast food consumption. C. Fasting and cleansing diets. D. Sedentary lifestyle. 9. Which of the following practices is often used in naturopathy to reduce stress? A. Regular exercise. B. Overworking. C. Avoiding relaxation techniques. D. Consuming caffeine. 10. Naturopathy often incorporates which of the following to enhance wellness? A. Surgery. B. Radiotherapy. C. Herbal remedies. D. Chemotherapy. 11. Which of the following is a fundamental principle of naturopathy, emphasizing the importance of identifying and addressing the underlying causes of illness? A. Symptomatic relief. B. Placebo effect. C. Identify and treat the causes. D. Palliative care. 12. Which of the following is not a modality commonly used in naturopathic treatments? A. Acupuncture. B. Homeopathy. C. Chemotherapy. D. Massage therapy. 13. Naturopathic medicine considers the mind and body as A. Separate entities. B. Unrelated to health. C. Interconnected and influencing each other. D. Independent of each other. 14. Which of the following is not typically included in a naturopathic consultation? A. Detailed medical history. B. Physical examination. C. Laboratory tests. D.